This is a variant linear accelerator, which is the device that we use to produce radiation therapy to treat patients. And we use it pretty much exclusively here to treat prostate cancer. There are other types of cancer that we treat, but the vast majority of the people we treat are treated for prostate cancer. The beauty of this particular machine is that we are able to use the high energy radiation beam to focus very specifically on the prostate gland and the tissues that we choose to treat around the prostate gland. And we do this with two forms of radiation, two ways to deliver it. One is called IMRT, or intensity modulated radiation therapy, and then the other form is image guided radiation, or IGRT, and those are two of the modern high-tech state-of-the-art ways to deliver radiation. We've been getting better and better with computer technology, focusing the radiation smaller and smaller, but what we've not been able to really eliminate until just recently is the prostate motion. And depending on the fullness of the bladder, or maybe the rectum, internal organ, even breathing motion, sometimes the prostate will move, and sometimes it'll move half an inch or even more between treatments, or just in a short time. And what we're able to do with the IMRT and IGRT is focus the radiation on the prostate, and we do that by several methods. The computer technology allows us to be very conformal, we call it, where we treat right around the prostate, and we can carve the radiation away from the rectum and away from the bladder and the pelvic bones, like the hip bones, so that those normal tissues get less and less radiation. The prostate motion is controlled by putting a little marker seed, and it's typically a gold, very dense, metallic, small little seed that the urologist puts in the prostate gland. And then when we put the patient on this machine every day, we take an x-ray, and that seed shows up on our picture. And we can't see the prostate, but we can see the marker in the prostate. And so we can take that image of that little seed and we can shift it to where it's precisely where we want it to be. And of course, the prostate goes with it, so the prostate is exactly where we want it. And then we can focus very directly right on that, so that if the prostate moved a little bit, if the bladder's a little fuller one day than the other, it doesn't really make that much difference, because we're adjusting the prostate to be right where we want it each day. And that's the image-guided radiation. That's the IGRT.